Thanks for your patience, everyone. We're having some slight technical difficulties with our guest, but we'll be starting shortly. In the meantime, I'd like to welcome you all for coming and thank you for joining us today. I'm Megan Fisk-Clements, FOSSE's Food Science Advisor. At FOSSE, the focus is to understand, translate, and intervene with food allergies. And one key question that our research aims to address is, why is there such a rapid increase in food allergies over the last few decades? So in September, we started this seminar series, the Project Safe: Impacts of Chemicals in Our Food and Environment. This Project Safe series highlights the science of adjuvants in food and the environment. Adjuvants being substances that are known to enhance the body's immune response, like a sensitizer. An adjuvant is often put into a vaccine to make it more effective. We have an exciting lineup of speakers for this upcoming series this year. We're at seminar number 3 of the series. And throughout the seminar series, we'll discuss how chemical components found in food and in the environment, both naturally occurring and synthetic chemicals, could be involved in stimulating the different biological responses in humans. So at FOSSE, we are particularly interested in learning how these chemicals could impact biological pathways associated with food allergies and contribute to the development of the allergic diseases. So please join us monthly for these seminars where we'll spotlight the critical research and science and learn from experts in the field. And as you can see, each of our speakers have different specialty expertises. So we did an overview with Ruslan in September, and we went deep on some of these naturally occurring chemicals with Noah last month. And those recordings can be found on the website if you'd like to catch up on any of them. So today we're hoping to speak with Thomas Hartung about toxicology and this sort of universe of food chemicals, analyzing the scale of chemicals in our environment. Thomas is the chair for evidence-based toxicology at Johns Hopkins University in Bloomberg School of Public Health. So as soon as we have him, we will start the interview. But he was able to speak with us in our in-person all-day talks a few months ago, and his research is wonderful, going deep into the toxicology and grounded in how toxicology has been studied for some time, but also looking toward the future. We are starting to know about more chemicals than we can test by the original methods in mice or rodents or even cells. How do we go beyond these wet lab research methods and look toward the future? So as soon as he's able to join us, we'll be having that conversation. So just hang on tight, and we hope he'll join us soon. In the meantime, if you have any questions about toxicology for Thomas, or any questions for FOSSE in general, feel free to pop them in the chat. You see a chat box at the bottom, and it'd be great to hear from our audience as well. If you have any thoughts on previous seminars or anything, feel free to chat us. While we're waiting for these technical difficulties to clear up with Thomas, if anyone has any food science questions, feel free to put them in the chat too. That's my favorite topic to riff on while I'm waiting for technical difficulties to be sorted out. Oh, we're getting a question. Can you tell us what FOSSE does in the food chemistry space? What are you looking for? What a great question. So as the food science advisor to FOSSE, I came into FOSSE and I saw so many brilliant biomedical researchers, pharmaceutical researchers, but not as much deep knowledge into the food side. So I'm so happy to be partnering to say, how can we investigate all these food chemicals, both naturally occurring and synthetic, and how they are impacting food allergies and even beyond food allergies into atopic disease. My background is in food science. I have a PhD in food science and biochemistry. And my last few jobs have been looking at how computational methods can be used to assess all the food chemicals we know about and how they can impact health. As there's new computational methods coming out using AI and other big data techniques, there's a whole horizon of research that's really opening up. So I'm glad to be talking about that with everybody. With the synthetic chemicals, we're often thinking about additives, stabilizers, emulsifiers, things like that. Also over-the-counter medicines, environmental chemicals, things like that. Hey, Thomas, I see that you're here with us. It's wonderful to have you. I got the mic, so I was just talking about food science because it's my favorite topic. But I think we're all here to talk with you about toxicology. So if you don't mind coming in hot, I'd love to give you the mic. I already introduced you and told them all how wonderful you are. So we're looking forward to hearing.
I love this. I'm very sorry. I have to tell you, I have done at least 200 webinars on Zoom, and I never had such login problems like I had today.
We're glad you're here with us now. If I can just tee you up, would you tell us more about how you got to your area of research? What's your experience and what brought you here? What inspires you?
Absolutely. I have a big heart for animals. I don't like them to be treated badly, but I made a big bad choice. I became a pharmacologist and toxicologist, and this is the area where you definitely need them. And so I focused already in my master and PhD 35 years ago into trying to find alternative approaches. And yeah, 35 years, there was not much. Now we have AI and we have cell culture, modern cell culture, microphysiological systems, and I'm thrilled that we can actually offer something. And
Yeah.
this is what I'm trying to get across.
As a biologist, I completely relate to that. So I know you're also not in the US. So tell us more about the differences that you see between the EU and the US regulations in terms of what chemicals are allowed to be used in consumer products.
Yeah, there's actually quite a difference, especially with respect to the animal welfare side. I'm European. My accent gives it away. I'm German. I lived now 16 years in the US, so I have, I think, a good understanding of both sides. I worked 7 years for the European Commission, so I was involved exactly in this field. And you have to imagine, Europe did already in 1986 pass legislation for all member states that if there is a alternative to an animal experiment reasonably available, you have to do it. It's illegal to do an animal experiment. In the US, we are far away from this. Our animal welfare legislation even excludes rats, mice, and birds. At the very end, it says all the animal welfare does not really hold here. And as a fact, children in school can do animal experiments on mice and rats, and they do so at the Intel Science Fair and others, yeah, without any prohibition. Yeah. So a very different approach, and it is only now that because of the objective problems of the animal approach, there's more and more consensus. We need the new technologies. We need to have things which are more human relevant and faster and cheaper than what we have at the moment.
Definitely. So tell us about sensitization toxicology research. I know acute toxicology research is what we all think of. Is this new chemical? Like, does it hurt the animal? Will it hurt us? But sensitization research is different. Would you tell us more about that?
I mean, sensitization is an interesting test case. Allergies are increasing of the skin, of the gastrointestinal tract, of the airways. We do have some animal tests, originally guinea pig assays. In one of the very early alternative methods was actually to move from guinea pigs to mice, which is considered an alternative method because it uses less animals and it does not really wait until allergy is shown by skin lesions. In this case, it's a skin allergy test, but by just swelling lymph nodes. which is sufficiently indicative, and you can end the experiment. Yeah? But if you take these assays, yeah, and the guinea pig and the mouse are equally accepted, an analysis we carried out in 2016 already showed that they correspond only in 77% of the cases. So if you imagine they're both acceptable, you can go either for the guinea pig or for the mouse preferred, but they only get 77% of each other's. Yeah? And if you look into human skin sensitization is also special because you can test it in humans. You can discuss the ethics of this, but you can do patch tests and prick tests and things, put this on the skin and see whether there's a reaction. I think it's ethically problematic because you sensitize somebody against a substance, yeah, and this can change their life, yeah. But okay, that's a different story. We found some 500 substances for which human data were available, and the mouse assay in this case found 74% of them. And if you take such numbers, it's not a perfect world. Yeah, and we are not 70 kilogram rats, not 70 kilogram guinea pigs. So there is a good reason also to look for other technologies. And again, sensitization has been somehow the poster child of alternative method development, because immunology is one of the really very, very fast progressing sciences on a cellular level. We have a very good understanding what it takes to sensitize towards an allergen. You have typically for a small chemical, you have to bind to a protein or another structure, a hapten. Then it has to be delivered to the lymph nodes. The lymph nodes are presenting these structures, and then you see the proliferation of lymphocytes and everything. This is textbook immunology in the meantime. But most of this has been deciphered also in cellular systems. And it was possible to produce for each and every step of this cascade of events alternative approaches, cell culture experiments. So this was actually the first case for a relevant hazard by chemicals, which was replaced not by a single test, but by a battery of tests. The OECD, which is the library of test methods for all areas, calls this a defined approach, which means you combine several of these cell culture methods or also computational methods, and you come to a result which is in the end about 90% predictive of the right outcome. So better than an animal test, or better in predicting such outcomes. So this was a big achievement. So sensitization was really the forerunner here of simply admitting, yeah, we cannot replace one by one, but we can possibly replace with a battery of things. And at the moment, it is also the forerunner for a lot of the in silico work, so computational approaches, because again, we have good data sets, and good data sets is the starting point of everything. Yeah.
Yeah. So building more on that, tell me how AI modeling and computational methods are changing your field.
I mean, is there any field which is at the moment not changed by AI? It is fascinating to see. We have actually the synergy at the moment of three exponential curves. It is first of all data. The data in the world are doubling at the moment every 18 months. The second exponential curve is a very old one and long one. We know already, it's Moore's law. Computer gets twice as powerful every second year at half the price. Yeah, that's holds for 60 years. Yeah. But the third one is that AI gets more powerful every third month. Doubles every 3 months in power. So 8 times more powerful than last year's AI since deep learning was introduced, which was in 2010. So since 2010, AI has become 1 billion-fold more powerful. Yeah? 8 to the power of 10. And this is why it suddenly is surprisingly good. And This is why ChatGPT 3.5, which was creating this hype with generative AI as one type of AI, uh, was okay, was creating a hype, but also many people said it's a gimmick, yeah. Try it again now, 2 years later. It is so much more powerful, all of these models. And I'm not trying to advertise OpenAI or somebody. It is simply incredible how fast these methods assume human skill levels.
Mhm.
To give you an example, in 2022 already, 40% of all coding was done by AI. Last year, it is assumed that it's about 80%. Yeah. And coders, which were really seeked in the 2, 3, 4 years ago by all the big tech, yeah, were laid off over proportionally by the big tech industry, yeah, because they need less of them, yeah. They need some to write the right prompts to check out where the AI failed, but you need much, much less of these. And there's absolutely no reason why AI should not also help with toxicology. Yeah, it's a very human skill. I cannot say that it is the rocket science of but it is something where you have always the same problems. You have to retrieve data, yeah, because you need to know what's already known about a substance, or also what is known about very similar substances, because this helps a lot to be consistent. And I can tell you, AI does it so much faster and so much better than any human can do
Mm.
if you only give it access to our data.
And do you
I-
feel like there's a lot of computer models being developed right now, or is there more of a consensus model? Like, how is computational methods in AI, how are they changing toxicology work right now?
I mean, at the moment, we have a situation of Wild West, where there is here and there some developments, and everybody wants to be the first and the biggest and the nicest and make a big claim. But we are seeing at this moment that there is a tremendous change, that the agencies, which are the ultimate recipients for safety data, that they are opening up. We see that NIH and other funding mechanisms at the moment are investing into this, and seriously. The NIH has started this year a program out of the common fund of the directors, which receives likely about $400 million over the next 10 years. It's called Complementary. It was really remarkable. Normally, the direct sponsors a handful of projects, and they decided for 1 year to push all the money into alternative approaches, alternative and complementary methods to animal testing. So not only AI, but also these modern cell cultures. Yeah, and that's a big commitment. Yeah, and money makes the world go around, and scientists follow the money stream. Yeah, so this is already very important. And ARPA-H, the new health funding agency, which is very nicely equipped with about 1.5 billion per year, just started the Catalyze project, which is to develop AI for drug safety. And I mean, everybody who can write AI is now writing grant applications to them. Yeah, so there is a tremendous change. Everybody understands you cannot not use it. Yeah. I can give you an example from my practical experience. Last year in September, so exactly a year ago, I was peer reviewer for a risk assessment the EPA the EPA had commissioned, and was carried out on a data poor chemical, which is relevant as a contaminant in industrial sites. So they had 2 people work 18 months on this, essentially to find all the data around this substance and some similar chemistry to, in the end, present an estimate of what this substance probably is doing. This is about $400,000 costs. I don't know the exact sum, yeah, for the contract that it received. After I did my review of their work, I tried the large language models. And I asked ChatGPT 3.5, which was at the time the free version of ChatGPT, which 99% of the people were using. It found nothing, nada, zero. I then used ChatGPT 4, which 1% were using. It found some of the stuff. But as soon as I also used the plugins, which gave it internet access, and some others, I found all of the information. All of the information the EPA had found, all the sources. And I also checked a few others. Bard and Anthropic's Claude. Claude did at least as good as OpenAI. Fantastic retrieval of information. But Perplexity AI even found an entire risk assessment done on this very same substance by the Risk Institute for Fragrance Materials, which was missed by the EPA colleagues. And this work did cost me less than 1 hour. Sure, I did not go to the details to extract everything from the sources, but I had the lead from this, yeah. And it shows you that alone data retrieval, not even any work in evidence integration, is simply doing the job, yeah.
Definitely. Well, AI is a really fun topic, but I want to make sure in our last minute or two, we plumb your expertise on toxicology a little bit more. So as you see the field and as it is developing, what do you think is missing still, especially as your research in toxicology touches this work that FOSSI is doing with adjuvant effects of some of these chemicals towards sensitization or toward food allergies or atopic diseases? Do you feel like everything that's needed is already here, or do you think there are gaps? What's still missing?
No, the AI is wonderful, but the answer has to be in the data. So wherever we don't have adequate data, we cannot expect the best AI in the world to find them for us. Yeah? And this is the reason why we need systems to produce data, and increasingly these are human cell-based systems. But we also need to systematically produce them. For example, most of toxicology is done on pure single substances. Our life is not exposure to pure single substances. We are exposed to hundreds of substances. The average American is exposed to 111 chemicals through cosmetic substances every day. 111, yeah. Women a few more, men a few less, but tons of them, and permanently changing. It's not the same all of your life, yeah. But these combinations, and most of them are really harmless things here, but we need to find out where there is these cocktail effects, yeah. In this case, not the mix which makes you more drunk, but the cocktail effect of being more toxic when coming together, yeah. And this
I
is
100% agree with that, especially as a food scientist. No food is a single pure chemical. It's all these cocktails of thousands of them.
Yeah, this is a big lack. Personalized toxicology is another one. We take the same stuff and have completely different reactions. These are things which we also will not be able to find out with our inbred and outbred animal strains, which are genetically very reduced. We absolutely need human diversity to come in, and this can only be done with human type of test systems. Yeah.
That's true. All right, thank you so much. I know we're on a shorter time because of the technical difficulties, but I really appreciate you joining us today. And thank you for everybody who's watching us, helping us come on this journey to better understand the impacts of these natural and synthetic chemicals in our food and environment and how they impact food allergies. So we often get asked here at FOSSI, how can people get more involved? People can donate, you can host an event, you can connect with us on social media and join our webinars, and you can also reach out to us. We're happy to have conversations with people as well. Join us December 10th at noon for our next seminar with John De La Pera, who will discuss the Periodic Table of Food initiative. So thank you so much, and see you next month. Bye, everybody.
Okay.